Well, hello and welcome. My name is Mariana Bolivar. I am program lead at MQ Mental Health Research, and I'm here to share with you some essentials of lived experience involvement and engagement, particularly applied in mental health tech research. And I hope you find it useful and enjoyable. And I will start by outlining the key points that I'm going to talk in this presentation. So first, I'm going to give you some background about us, MQ Mental Health Research, and the role that we play in this project. Second, we are going to discuss why is lived experience involvement so important in research and particularly in technology development. And and then we are going to go through some essentials of lived experience involvement and close with a summary of key messages that we hope you take from this talk. So I will start by giving you a very brief overview of the work that we do at MQ Mental Health Research. We are a UK-based charity, but we work globally, investing over 3 million in research across disciplines and over 37 countries. And we do this by different activities. We deliver ground rounds, we convene and consult stakeholders, and we partner in different research collaborations. And as part of these collaborations, we are really excited to be working with the Health Innovation Network in the Mindset XR Innovation Support Program. And our role would be to facilitate the involvement of lived experience across the program and support you and other stakeholders to make these collaborations constructive and successful. And before digging to the most interesting parts, I just wanted to mention a few terms just because these are different ways in which we refer in the literature to both the people who participate in research, advising from a lived experience perspective, and also terms in how we refer to this process, but essentially they all mean the same, but it's important to take into account as you may find them in different resources mentioned in different ways. So just to go through a few, sometimes they are referred just as lived experience or people with lived experience, lived experience experts or advisors. And at the same time, when we refer to the activities, sometimes this is referred as co-production with lived experience, which is suggests a more collaborative and hands-on approach. Sometimes it's referred to as public and patient involvement and engagement, or PPIE, or as we are going to refer in this project as lived experience involvement and engagement. But in general, they are referred to roughly the same thing. So now I'm going to share with you a little bit of the of the factors that make the involvement of lived experience advisors so important in mental health research. And it's because ultimately the purpose and the aim of any research project, regardless if it's pharmacological or psychological or using digital technologies, is that mental health conditions are ultimately better prevented and detected and treated, and that all mental health products and technology that is developed really has an tangible impact in people's lives and help them to live happier and healthier. So that oversight is it's one of the key contributions of lived experience advisors in research projects. Another important reason why we need lived experience involvement and engagement in research is because most research projects, including technology development, fall in what we call the valley of death, which is essentially failing to have real life applications. And when they do, most of them take a long time to reach people's lives or to have a tangible impact, which is estimated to be around 17 years. And as we know, there are very few resources for research, and we need to make sure that they go to the most promising areas. And through our work and others in the sector, there's nowadays a huge consensus that lived experience is a critical element to inform research from the start, and it's a critical success factor to help research overcome this valley of death and help people improve their lives in a way that is most meaningful to them. But we don't only know that lived experience involvement is important. Recent experiences in research suggest that the more involved, the better. And while before participation of patients was limited to take part of a research study, increasingly there was an awareness of the need to engage them more actively, share information and knowledge, and disseminate more widely through communities and third sector organizations. Then research started to directly involve lived experience experts through different partnerships, and this has evolved to co-production, where in some research projects the scientists themselves and the practitioners and the lived experience experts share power and responsibility. And we have increasingly more experience of survivor or user led research, where they have most of the decision making power and influencing the direction of the research study. What happens when lived experience is not involved? I'm going to illustrate with a very simple but real life example of a pharmacological company and a technology company which partnered to add a tracking device to antipsychotic medication, and in this way improve adherence to medication, which is usually a difficulty in patients with psychosis. And despite passing all the market tests and the technology feasibility, what was not taken into account is that the feeling of being tracked can be highly distressing for people with psychosis, which ultimately led to the failure of the product, and of course to significantly loss of resources. You of involving people with lived experience in research, there are still barriers to ensure that this participation is meaningful and equitable. And I'm just going to name a few very quickly, just because this might be useful to think as you develop your strategies for lived experience involvement. One of them is digital inequalities, which of course recruitment processes tend to be digital, which also exclude people who do not have access to the internet or devices. Another barrier is that involvement in research requires time, requires attention and resources, and it is important to connect with the real life needs of people, with their career progression, with their financial needs, and with their practical priorities. Another barrier is tokenism, which is essentially some practice of including people with lived experience, but without meaningful influence in decision making or in guiding the research project or product development. There can also be communication barriers, use of jargon, difference of expectations or communication styles can also be challenging, but at the same time, the sector has advanced considerably to bridge them. And lastly, a key challenge is stigma, both within research and on the ground, which is, of course, an obstacle for people to want to participate and engage with mental health research. In some of these barriers, we will have the opportunity to explore in more detail in later stages of the project. And well, I will close with some key messages that I hope you take away from this brief overview, and that I hope are useful to inform the work that you are doing as part of the project and in the future. And these key messages have to do with the importance of lived experience involvement. First, it is crucial to ensure that technology products bring tangible improvements to people's lives according to their views and priorities. The involvement of lived experience is also fundamental to overcome the valley of death in research and accelerate applications in real life. It is also essential to make sure that investments go to the most promising areas and avoid waste of time and resources. And lastly, lead experience involvement is very important to ensure that there is consideration for digital inequalities and mental health inequalities more broadly. Well, with these key messages, I close, not without first wishing you a very successful and productive roadshow. Thank you so much for your attention, and see you in next stages of the project.